Hello everyone, I'm back again with a new video on my channel, The Courageous Nurses. I hope you learn in an effective way from my video. So let's start without wasting much time. So as you can see that today we will talk about the epistaxis. What is epistaxis? Epistaxis here it means the nose bleeding. The nose bleeding it refers to the epistaxis. So let's start with the introduction. Epistaxis, a hemorrhage from the nose, or we can say bleeding from the nose. It is mainly caused because of the rupture of tiny distended vessels in the mucous membrane of any area. So our nose, it consists of various sides from which the bleeding can occur. Here as you can see, it is written the anterior ethmoid artery, the sphenoid palatine artery and the internal maxillary branches. So these are the various sites which I will show you the picture. You will see the various sites from where the nose bleeding can occur. I have put a picture so you understand the concept very clearly. And second thing, I have written all the content so you can just jot it down in your notebooks. Okay, so we will see the picture. Here you can see this is the anterior ethmoid artery. This is the main area. This is the main area where you can see the maximum nosebleed or epistaxis, as this area is also known as your Kieselbach's plexus. Okay, then we have got posterior ethmoid artery and sphenopalatine artery, which is present over here. Okay. Now we will see the definition, as we have to go systematic way, so we will see the definition. A hemorrhage from the nose, referred to as epistaxis. It is caused by the rupture of tiny distended vessels in the mucous membrane of any area of the nose. So this is a proper definition of your epistaxis, which says that there will be bleeding from the nose and it can cause mainly from the rupture of the tiny distended vessels which is present in your nose, the various arteries which is present in the nose, that will cause the bleeding because it has been ruptured. Now we will see the various types. There is mainly two types, the anterior epistaxis and the posterior epistaxis. As you can already see, it is already written over here. The most common anterior epistaxis is most common and it is less severe. But in case of posterior epistaxis, it is less common, more severe, and it is difficult to control because it is at the back side. We cannot reach the back side easily. But when it comes to anterior epistaxis, with the help of first aid we can do some kind of management. So we will see, it is written over here, it refers to a nosebleed that originates from the anterior frontal part of the nose, which is the place that is your Kieselbach plexus. This is the main place because of which we can see the anterior epistaxis, which is a vascular network found. As you have already seen in the picture, it was a vascular network. There was a lot of arteries. So because of that, it is very much common due to any trauma, or if the person is poking his nose. So because of that, anterior epistaxis can occur. In case of posterior epistaxis, what it is written over here, it is most often, it originates from the Woodruff plexus, which is a vascular network found in the lateral wall of the nasal cavity. Posterior epistaxis usually involves both nostrils. For these types of nosebleeds, the blood may also flow backwards and uncomfortably get swallowed or coughed up. Often diagnosis of posterior epistaxis occurs after failing to manage an anterior epistaxis or noticing bleeding into the posterior pharynx or throat. And this posterior epistaxis, it is mainly seen if there is any kind of major disease condition, if there is any malignancy, if there is any nasal polyps. So in such kind of cases we can see the posterior epistaxis. But anterior we can mainly see if there is any picking of the nose, if there is any trauma of the nose. Okay. Now we will see the various causes of our epistaxis. First, it is written the local infection, that is the vestibulitis, rhinitis, sinusitis. So because this itis is present, so we can understand there is some kind of infection, there is some kind of inflammation. But what does this vestibulitis means? It means that because of an infection, there is nose bleeding and it has mainly result from nose blowing or picking. Rhinitis, it is mainly your stuffy nose, irritation and swelling of your mucous membrane in the nose. Sinusitis, There will be inflammation of your sinus. Now coming to systematic infection, any kind of scarlet fever, malaria can lead to your epistaxis. Drying of nasal mucous membrane, taking of steroid like that, or taking any kind of drugs like that can cause your drying of nasal mucous membrane. Then nasal inhalation of illicit drugs, that means your illegal drugs, that is your cocaine. Trauma, digital trauma as in picking the nose, blunt trauma, fracture, forceful nose blowing. Hypertension, your excessive hypertension can lead to your epistaxis. Tumor, sinus or nasopharynx. Thrombocytopenia, your low level of platelet in your body can lead to your epistaxis, because the platelet is low, the coagulation process is very slow. Because of that, the epistaxis, the bleeding can occur from nose or from anywhere else. Erythrosclerosis, there will be presence of plaque in your vessels, in your blood vessels, because of which it will be constricted. Use of aspirin, aspirin we know it is an anticoagulant, so if a person is taking aspirin, then the person can have epistaxis. Any kind of liver disease, then this is a word, as you can see, Rideau-Osler-Weber syndrome. This is also known as hereditary hemorrhagic telangiectasia. Now what is this? It means it is a rare autosomal dominant disorder that affects your blood vessels throughout the body and results in a tendency for bleeding. Okay, so this means it has affected your blood vessels. Now we will see many other causes. The other common causes of nosebleeds include colds, upper respiratory infection, and sinusitis, especially episodes that cause your repeated sneezing, coughing, and nose blowing. Any allergic or non-allergic rhinitis. Blood thinning drugs, which we have already studied, the aspirin, NSAID, warfarin, and others. These are mainly your anticoagulant drug. Cocaine and other drugs, your illegal drug. Chemical irritants like your chemical fumes at the workplace, other strong odors, high altitude, as the air is thinner and drier as the altitude increases. Deviated septum, it can lead to epistaxis. Frequent use of nasal spray and medication to treat itchy or running nose, it can also lead to your epistaxis. And of course the alcohol use. Bleeding disorders such as hemophilia or von Willebrand disease or leukemia, any kind of blood disorder, it will lead to your lead to your thrombocytopenia. What is that? That is your low level of platelet in your body. Because there is low level of platelet, bleeding can occur from anywhere. It can be from nose, mouth, or any other place. So the people who have this bleeding disorder, they are more prone for epistaxis. Then high blood pressure, which we have already studied, erythrosclerosis, facial and nasal surgery, nasal tumor, nasal polyp, immune thrombocytopenia, leukemia, and pregnancy. Now we will see the pathophysiology. So there are many different reasons for the tearing of your blood vessels of the nose. So the first one we have talked about it, that is the trauma, nasal picking, coagulopathies, and tumor. Because of these various reasons, the epistaxis can occur. In case of excessive hypertension, that is your risk factor, it can cause your epistaxis. Now the technique of lowering blood pressure to control and prevent epistaxis remains controversial. Coming to anterior epistaxis, we know it is mainly usually due to the Kieselbach's plexus. In case of posterior bleeding, it is mainly due to Woodroff's plexus. And because this is your posterior, that means it is at the back side. So because of that, there can be aspiration and it can lead to bleeding with coughing and hemoptysis. There can be aspiration of your blood, and which can lead to your bleeding from your mouth while coughing, bleeding while you are vomiting. So in such kind of cases, we can see the bleeding. Okay, so we can see the posterior bleeding has occurred, and posterior bleeding, it can compromise the airway if blood leaks into the posterior pharynx. So this is a basic pathophysiology of your epistaxis. Coming to the clinical manifestation, it is dizziness because there is excessive bleeding. So dizziness can occur. Confusion can be there. Bleeding from nose. Anxiety can be there because the person has become anxious. What has happened suddenly to him? He's having bleeding from his nose. So anxiety is a very common thing. Hemoptysis or hemoptymesis. Hemoptysis means coughing up of blood, and hemoptymesis is your vomiting, bleeding while vomiting. Shock in case of severe epistaxis. So in such kind of cases, we have to give the person the fluid, we have to transfuse the blood and everything. Coming to the diagnostic evaluation, history, we have to take proper history, what kind of medication the person is taking, whether the person has gone through any surgery, any nasal surgery, if the person has got any septum deviation, if the person has any history of epistaxis, everything we will know. Careful inspection with nasal speculum to determine the site of bleeding. Laboratory investigation to exclude blood dyscarrias and coagulopathy. Coagulopathy, the person is having low platelet, blood dyscrasias. Dyscrasias mainly means some abnormal part of your body. The part which has to be in its normal place, it is not like that. It has become abnormal. Through X-ray, magnetic resonance imaging, complete blood count and blood pressure, of course we have to see rhinoscopy, nasal endoscopy. So these are the following diagnostic evaluation through which we will see the epistaxis result. Here I have given a picture of rhinoscopy, so you can understand this thing will go inside, and through this the doctor will understand the severity of your epistaxis. Now we will see to the most important part of your epistaxis, that is your management. Because we are into the paramedical field, we should be knowing the management. First is the first aid. The littles area, we should be pinching the nose with thumb or index finger at least for 5 minutes. So we are giving the compression to the vessels. Then coming to the Trotter's method, this I will tell you in the next slide, where I have kept a picture so you can understand it better. Then coming to topical vasoconstrictor and the digital pressure. The vasoconstrictor, we already know what it will do. It will constrict the vessels, because of which there will be less bleeding. Then coming to plaquettes or cotton balls soaked in vasoconstrictor and lignocaine. How we are going to do the injection of lignocaine, at least 1% with 1:1 lakh epinephrine into the greater palantar foramen bilaterally. It will be helpful for the posterior supplies contribution. What it will do, it will slow down the posterior supply. So but there will be caution. If the patient has got any heart condition, we have to be cautious about that. For the such patient, we cannot use the epinephrine. Then this is the Trotter's method. See how the lady has sat. She has sat in the chair. She has just forwarded herself. She has leaned forward little bit, and she has pinched her nose. So this is your Trotter's method. So if any bleeding is coming from the mouth, she can just cough it up. Okay, so this is your Trotter's method. Now we will see the various surgical management. First is the cauterization, second is your silver nitrate, and third is your packing. So in cauterization, what does it mean? So cauterization, mainly it is performed with a chemical or with electrocautery. What it will do, it will destroy the tissue using a hot or cold instrument. It can be electrical current or a chemical that burns or dissolves your tissues. Okay, so that is your cauterization with the help of your silver nitrate. And we can also use a stick with the help of silver nitrate at the end, which will touch the area which is bleeding, and that will stop your bleeding. Now we will see the third part of your surgical management. If the cauterization is not helpful, at that point of time we have to go for the packing. Okay, so in case of packing, what we do mainly, we use the Foley's catheter and gelatin thrombin mattress combination, and this packing is mainly used in case of for posterior epistaxis. What we will do, the procedure is spray at least 4% lidocaine or phenylephrine to administer topical anesthesia. Okay, it won't be general, it will be your topical anesthesia. After that, place a 12 French Foley catheter into the posterior nasal cavity, and we will inflate. That means the air will go inside the balloon, at least air or any liquid substance, at least 5 ml. 5 ml of sterile water or saline we will inflate with the help of that. What it will do, it will provide a temporary pressure around that nose area, so bleeding will be stopped. But what if we are seeing bleeding from oropharynx? At that point of time, we have to let the sterile water go away from the balloon. We will deflate the Foley and pass it into the nasopharynx, and then we will again inflate it and pull it entirely so that it occludes the choana. This will usually redirect the flow of blood anteriorly instead of into the airway. Prepare gelatin thrombin mattress product. See here, you can see the Foley's catheter, how it has been inserted and then it has been deflated. So we can see a nose packing over here. Now coming to post-procedure prevention, avoidance of any digital manipulation and trauma. Humidified air may assist with moisturizing dry mucous membrane. Use a humidifier at home. For inpatients, remove nasal cannula and use humidified face mask or face tent. Okay, we have to remove nasal cannula. I hope you have seen the nasal cannula. It is something spiking and it can also cause your nosebleed. Workup of bleeding disorder, systematic diseases by appropriate services if indicated. Correct blood pressure, platelet, uremia or INR if not contraindicated. Nasal saline spray and water-based gels to anterior vestibule to be provided. Deliver nasal spray medication with the contralateral hand to contralateral Neris technique with avoidance of spraying septum. Consider stopping nasal steroid until episodes abate, as the preparation have alcohol that dry the septum further. Coming to the nursing management, anxiety related to unfamiliarity with medical condition treatment modalities, deficit fluid volume related to excessive bleeding, blood clotting disorder as evidenced by weakness and pallor, fatigue, risk for infection related to loss of blood, surgical procedure as evidenced by fever and high blood pressure. I hope you have understood the video. Thank you so much for watching my video. Do like, share and subscribe my channel for more such videos. Thank you.